Many children aren't vaccinated against COVID-19. Many more aren't up to date on their immunizations. How much does this concern you and why?
Sure. Well, like you said, this is kind of our first year going back to normal, so to speak. And so I think with that being said, it's important for us to remember what was normal before COVID-19. And normal was going and getting your school physical in the summer before school starts and getting those vaccinations that were necessary based on your age. And so I think in the vein of wanting to be back into normalcy, that we need to remember that we need to get back into getting those yearly physicals. We know that routine vaccines help to pretty much eliminate some diseases that we hardly even hear about anymore, things like polio. And then when we hear about things like measles, we think, well, didn't they get their vaccines? And so that's just another reminder to say, yes, these vaccines are incredibly important to the health of our children. And getting back on track with those vaccines should be a huge goal for our parents this year in case they got behind during the pandemic. In terms of the COVID-19 vaccine, we do know that that is approved now for children as young as 6 months, all the way up to obviously adulthood then as well too. And we know that our children of school age who receive the COVID-19 vaccine, that helps to decrease their risk of getting the infection, but it also helps to decrease the severity of the infection if they were to get that as well. And so that is a huge kind of reason to want to get this vaccine. And I think another important thing for parents to think about is for them to understand and find out what the policy is for their children at school. So understanding that, what happens if a child in their students or a student in their child's class gets COVID. Does their child have to stay home if they're vaccinated, or is their child still able to go to school? And if their child is still able to go to school if they're vaccinated, that's great, because that means that their school day won't be interrupted. They won't have to go home and do the dreaded online learning, and they can stay in school and continue to learn.
Really important things to remember there. Let's talk about sleep. So how important is a sleep routine to a child? As the mom of a couple of boys, I know how much they don't like to sleep all the time, right? It's really fun to stay up. So talk about how much sleep kids should be getting and what happens when a child is sleep deprived.
Sure. Yeah, I'm learning this too now as a first-time mom. I have a 9-month-old who still enjoys getting up at least once during the night, so we'll get there eventually. But yes, sleep is incredibly important. I was reading yesterday, the American Heart Association released some information that stated that sleep and adequate sleep is essential to heart health. And so starting an appropriate sleep routine for your child only sets them up for success in the future as an adult and helps to promote good heart health for them as well too. And so we know that for our kindergartners, we want them to get about 10 to 13 hours of sleep each night. For our grade school children, about 9 to 12 hours. And for our teenagers, about 8 to 10 hours of sleep each night. And sleep only has benefits, right? It helps to improve their concentration at school. It helps to energize them. It helps them to be more engaged in school. And so these sleep just has incredible health benefits as well as behavioral benefits then too, in terms of what they're able to get out of each day at school. Like you said, I mean, it's really easy during the summer to get out of a sleep routine. It stays light out super late and everything too. And so as we're getting closer to that start date for school, I would encourage parents to start to move that bedtime back closer and closer to the school bedtime and do that gradually over a couple of weeks. And so if their summertime bedtime has been 9 p.m., but you'd really like them in bed at 7:30, then maybe start putting them to sleep at 8:30 and do that for a couple of nights, and then get it down to 8 o'clock for a couple of nights, and then gradually work it down to 7:30 so that it's not as big of a shock to the child that their bedtime is getting earlier and earlier.
So, we live in stressful times today, as we both know. We're still coming out of COVID. There have been situations and events on the news like mass shootings. What advice do you have for parents going into this school year? Again, this is about the closest we've been to normal since the beginning of the pandemic, but kids may have a little bit more stress and anxiety than they have in the past.
Right. Yes, we live in an age where information is available at the drop of a hat. We don't have to wait for the newspaper to come out the next day to hear about what's going on in the world. And so while that can be, that can be very helpful, at the same time, like you said, that can cause some extra stress and anxiety for our children. It's really important to not forget about communication. And so we know that in the workplace, communication is important, in the school, communication is important, but at home, communication is super important as well. And so if you're able to sit down as a family in the evening and share dinner together and just talk about the day's events, talk about what they learned at school, talk about concerns that your child may have, maybe friendship concerns, or maybe comments that other friends or other children have made, communication is key. If you don't have time to do that at the dinner table, then making sure that you're, talking with them as they have their evening snack, or spending a few minutes with them before they go to bed, giving them an outlet or an opportunity to express some of those emotions or some of those concerns that they have. That also gives you as a parent some time to maybe set the record straight for them as well too, in case they've maybe heard some information and haven't been able to process that accurately them too. And then, we always say for all of these concerns here, for vaccine questions, for concerns about sleep, for concerns about emotional health, anxiety, stress, we as your primary care providers, whether your family medicine doctor or your pediatrician, we're more than happy to speak with you about that, especially at that well child check that we would really love you to have each year. And so reach out to your physician. We're here to support you, and we're here to make sure that your child is in the best space possible to have a really productive school year.